Hey friends, so today I wanted to talk about a strategy that you can use for the Step 3 CCS cases. Step 3 is this really long 2-day exam. As you know, that at the end of day 2 has about 4 hours worth of cases to go through. There's about 13 cases that you have to do, varying from 10 minutes to 20 minutes each. And I just couldn't find really a whole lot online that offered like a strategy to go through the case a little more systematically. So I figured I would kind of make one of my own. So just jumping right into it, the very first thing you do is you're going to get a prompt that tells you kind of the basic info about the patient. And I think it's really useful to write down some of that basic info on your whiteboard, just really quickly to jot some things down. Namely the age, the gender, and then any sort of social information. So in particular, anything related to their vices. So any sort of alcohol use, if they are a smoker, and then if they are sexually active. Because those are going to be the things that you refer back to when you need to do counseling at the very end of each case. And then age and gender is useful just so that it's a reminder as you're going through the case, kind of what demographic you're in, and then again later on when you need to do any sort of routine screening things, it's useful to have that. So next, you're going to get the HPI, which will kind of tell you, is this case an emergency or is the patient a little more stable? Once you know this information, you can decide if you need to put in any sort of emergent orders. So if it's an emergency, or if not. If not, then you're going to go straight to the physical exam. But if it is an emergency, some orders that you can think about putting in are going to be like a pulse ox, plus or minus oxygen, cardiac monitoring. IV access is going to be important to have if you're thinking about doing any sort of IV medications or IV fluids. And even under these emergency orders, you can consider starting something like normal saline. And then think about any sort of like emergent test that you want to do. So like a point of care glucose, EKG, something like naloxone could go here as well. And these are things that you can and in some of these cases should put in before you even jump to the physical exam. So the next thing is going to be the physical exam. This is also going to be determined by whether the patient is stable or not. So if the patient is stable, then you can go ahead and do a complete physical exam. So just check all the boxes, do the full physical. If they are not, I would do a little more of a focused physical exam. So something like heart, lungs, and then whatever organ system they're presenting with. So if they're there with abdominal pain, do an abdominal exam. Like altered mental status, do a neuro exam, something like that. Don't waste time doing the entire physical exam, and in fact you can get points off by doing a complete physical exam and someone who's there emergently. So by this point you've got the HPI, you've got the physical exam. You should have a pretty good idea of what's on your differential, and this is going to help you with the next step, which is going to be what sort of labs and studies do you want to do. So I really liked the IBUOP mnemonic, which stands for images, blood work, urine studies, other studies, and then pregnancy test. So imaging, you want to think if you want any sort of like X-ray or ultrasound, CT, MRI, echo, VQ scan, all of that would fall under like images. Blood work, you want to think of like your BMP, CBC, blood cultures. Let's see, what else can you, like an EBG would fall under this. Really like any major blood studies, like this is kind of the next category that you would think of. Urinalysis will be kind of the next one. Utox, ketones, for instance, if your patient is in DKA. Other studies can be a little more broad, but you can think of, for instance, like an EKG, peak flow, biopsies, any sort of procedure like an arthrocentesis, thoracentesis, LP is another good one, would go under other, and then a pregnancy test. So obviously if the patient is a young female and you think that the treatment or her presentation might be related to it, I would get a urine pregnancy test. And then if it's positive, you'll go down that rabbit hole and do any other sort of further lab workup that you need. So after you've gotten some basic studies, you can progress the time. So the exam works in like real time and simulated time. Real time is going to be the actual number of minutes in real life that are passing while you're kind of putting in all of these orders. Versus simulated time, you have to actually click a button to advance the time in the case itself. So usually by this point, you're going to advance the clock a little bit, at least to get some of the results of these studies, at which point, once you know the answers, you'll decide if the patient needs to be upgraded or can go home. It'll kind of let you decide what's the most appropriate location for this patient. So your options for location are going to be, you can like send them home, you can send them to the ER if they came to the clinic, you can admit them to the hospital, or you can admit them to the ICU. If you're going to decide to admit, you're going to need some further orders that you need to put in. In particular, you want to decide if you need any sort of like IV access if you don't already have it, fluids, you want to decide what sort of diet. Do they need to be NPO, for instance, if you're thinking they might need a surgical procedure? What sort of activity level should they be? Do they need to be on bed rest, for instance? Or like head of bed elevated? Do they need any sort of tubes, like an NG or Foley? Do you want to measure ins and outs, which on step 3 is called urine output? And then how often do you want your vitals? Going on Q4, Q8. And then also think about if they need any sort of like DVT prophylaxis or like pneumatic compression. And finally, you want to think about symptom management. So if they're in pain, I would maybe order like some morphine or Tylenol. If they're nauseous, do some Zofran or like Phenergan. That'll kind of help you get at least started on treating the patient as well. So once you've got that done, you can approach, the next thing will be treatment, essentially. By this point, you should have an idea of what's going on. So you should be familiar with kind of what the treatment is going to be. So often for these cases, it might be like antibiotics if it's something infectious, or maybe steroids if you've got a patient with like a COPD exacerbation, for instance. Often you might need to place a consult, and this would be an appropriate time to do it because by now you kind of know what's going on. So the consultant might actually have appropriate recommendation for you, whereas before you know what's going on, they might just say continue your management. We don't have any recommendations. If you consult them after you've done any sort of like imaging or lab studies, they'll be able to better tell you like, wait, we'll schedule the patient for surgery, continue your management, or something like that. If the patient is going to need surgery, you will need to do some further lab workup for step 3, which will include like your PTT, PT, INR, perioperative cefazolin, type and cross. You can think about an EKG if they're high risk candidate for surgery as well. And then also start to think about like, do you need any sort of like monitoring labs for this condition? Like if they're a GI bleeder, do you need to do an H&H, Q6 hours, Q12 hours? Do you want to do a daily BMP if they're here for like an AKI, for instance? Do you need to trend a CRP? All of those will be kind of like your daily in-hospital monitoring labs, or if you're outpatient, for instance, like a weekly ESR or something like that to follow with the patient's condition. By this point, the patient should be making progress one way or another. It's a good idea to reassess. I would do another physical exam, usually focused at this point. And then I would also ask for an interval history. This will help you decide, is the patient improving or are they not improving? And you can also kind of reassess, are you doing the right thing? Do you need to change your management? Are they not getting better? Do you need to give it more time? Kind of take a step back and see like how the case is going, and then see how your patient's doing as well. So by this point, hopefully if everything has gone well, your patient should be improving or getting better, or at least has a management plan in place. You can start to think about kind of the long-term things. So this is going to be things that you're going to want to follow up as an outpatient or in the future. This is going to be where that basic info that you wrote down in the beginning is going to come back around. So you want to start thinking about their demographic info and then what sort of counseling you want to do for the patient. So for screening, start to think about, like, are they going to need a colonoscopy eventually? Are they an older woman and need like a mammogram? Pap smears, vaccines, another great one. Flu, pneumonia in particular. Zoster is another good one. And then if they have like a new diagnosis of HIV, for instance, think about doing like a PPD. If they're high risk, you can think about like Hep C screening. And then counseling as well. You're going to start to do your counseling on like safe sex practices, quit smoking, limit alcohol, and just really for everyone, wear your seatbelt. Car safety. So those are going to be kind of your less acute orders, but once the case starts to kind of wrap up and your patient improves, you can start to think about what do you want your patient to do in the future. And that'll be important. Often those orders will end up being in your final orders. So if you haven't done anything already, this is where you can do kind of like final counseling. And then often the last 2 minutes, which is what this is, it's really like the most shortest 2 minutes of your life, because 2 minutes sounds like enough time to get stuff done, but when you have to click into the orders and then scroll through the orders, and then often it's going to ask if you want to do them now or later. If your patient's still in the hospital, you're probably not going to want to do it now. So you're going to have to click into the calendar, click on the date that you want to do it, and that really takes up a lot of time. So I would be really careful with what orders you decide to do at this point, and also try to be efficient with how quickly you click through and add your orders. Because you're also going to want to maybe add labs to monitor, like if you started a new medication, or just to monitor the condition, for instance, like ESR. So these will be kind of like labs that you're going to follow up as an outpatient once the patient has improved. So that's really it as far as like a guideline to at least have a mental framework to go through the cases. I found it helpful. I really just went into the exam and kind of wrote everything down, this like framework down onto that whiteboard, and then referenced back on cases, especially where I got stuck or needed to decide, what do I need to do next to kind of progress the case and help this patient. So I found it really useful. I hope you guys do too. Good luck, everyone.